Okay, hello, my name is Aiman Haikal and my metric number is DIA 2026. Okay, now I want to talk about the social service and also the type of social service. Okay, now I will give you guys the objective of social service. Okay, the social service are the collection of public service aimed to providing support and aid to specific group, most notably to the poor lah. Okay, the individual actor, private and independent organization or government agencies may provide or administer them. As a countries with significant welfare programs frequently provide a wide range of social service. Social service are linked to the concept of welfare and the state of welfare state. A social service are used to address a society vast range of requirement. Prior to the industry revolution, social service are more are limited to the provide organization and charities, and the coverage was likewise limited. Social service are now widely viewed as essential functions of a society and a means for government to solve societal concept on the worldwide scale. Government provision of the social service is the based on universal human right, democratic ideals, as well as religions and culture belief. Within the societies, the availability and coverage of social service varies greatly. Families, children, teens, elders, women, and the ills. The stable are the key of the category serviced by the social service. The public education, food bank, universal health care, police, fire service are example of the social service facilities and service. Okay, the example that I can give you guys is healthcare. Okay, the prevention, diagnosis, treatment, recovery, and the cure of disease, illness, injury, and the other physical and mental disabilities in individual is refused to the healthcare, also known as the healthcare or healthcares. Okay, healthcare is provided by the specialists in the medical and allied health sector. Health professions include doctor, dentist, pharmacist, midwife, nurses, optometrists, audiology, psychologists, occupational therapists, physical therapists, athlete trainers, and others. Its compensations work in the primary care, secondary care, tertiary care, and as well as public health. Okay, the next is the child welfare. The child welfare of children is a primary focus in the all family welfare initiatives. Whenever possible, the children service are provided in the context of family life. Income support of for parents may aid in ensuring the basics security of the family unit. Maternal, prenatal, and child health care program are critical in the all countries, but especially in the those plagued by the widespread disease and malnutrition. Baby and maternal death rates are, in fact, in the most fundamental indicator of child welfare. The growing number of working moms around the world has resulted in the development of daycare service ranging from simple custodial supervision to educational and healthcare program. In some places, in some places, recognitions of the growing economic strain on the family life industry are comply to the provide such facility for the employers. Okay, the last example is the food bank. A food bank is the benevolence, not-profit organization that distribute food to people who are unable to afford enough to eat. Some food bank follow the front lines strategy, distributing food to the hungry on the spot, like many Malaysian do. Others employ a warehouse approach, delivering food to intermediate such as food pantries, soup kitchen, and others frontline organizations. Commentators have appraised the expansion of the food bank since them as an instance of the engaged. Caring citizenship, other scholarship and journalists are concerned that the expansion of the food bank may diminish political support of welfare. According to the research, food bank can be inefficient compared to the state-run benefit in some situations, and some people feel ashamed of having to utilize them. Okay, in conclusion, every generation face new opportunity as well as new risks as a result of the economic and social change. The necessities ongoing adaptation on the side of the social service, political consideration and resource level heavily influence how social service are organized, and how responsibility is the divide among the governmental, voluntary and commercial sector. Even in rich culture, the breadth and diversity of the requirement require formal social service to rely on the support information system to social care and mutual aid. The concept of the welfare state as a universal provided for the large passive population has never had any empirical reality of substantial theoretical basis. The there is about evidence of the general tendency toward closer linkage between formal and informal social care system. Yet this may lead to additional variance in social welfare service as communities grow more sensitive to indigenous culture diversity and establish to their own direction to change. Okay, thank you from me.